thoracic ultrasound in COVID-19 pneumonia, coronavirus infection. We talk on these lectures about the role of ultrasound in COVID-19 pneumonia, benefit of ultrasound over CT, it is cheap, easily accessible, it's easy to find ultrasound in many region and center, but CT it's not available. It is easy to do ultrasound in ICU, portable ultrasound in patient who cannot go to CT units. Thoracic ultrasound will be or must be basic examination for new generation of internists, new generations of doctors in ICU, new generations of doctors in radiology. We talk in this small short lectures about important point in chest ultrasound in COVID-19 pneumonia, not in details. Chest ultrasound technique, type of probe we use either convex, linear or cardiac probe according to the disease which we diagnose. We interested by consolidations, we can use linear probe or convex probe. This is image demonstrates how to divide chest anteriorly into 4 spaces and examine each space separately. And this is diagrams. We not miss anything or any regions or any lesions in the chest ultrasound. If you follow this classification, these tables on the chest, this imaginary line, and this is back of the chest, all divided into 4 regions. Lung always ultrasound must be done in 5 minutes for skilled doctors. Let's talk first about chest ultrasound, normal anatomy and science. Normal anatomy, when we do probe, we found fat and skin, next chest wall muscles and ribs. In between ribs, intercostal space, we go deep through the lung, found firstly pleura, lung tissue, air lines and lung. This is important sonographic anatomy in chest wall, skin and subcutaneous tissue, ribs with present as acoustic shadow. Bone on ultrasounds always appear as dark with distal acoustic shadow, intercostal muscles and pleural line which appear as white line. This pleural line in between ribs, this is intercostal muscles. Skin, ribs, intercostal muscles, pleural line. Again, pleural line is the basic of chest ultrasound which appears as white line like this, pleural line in between ribs and intercostal space. Pleural line is the basic of lung ultrasound. All sign lung ultrasound arise from pleural line except for subcutaneous emphysema which abolish pleural line. Pleural line, bright white line about 0.5 cm below the rib line. This is pleural line, rib line, white line, pleural line 0.5 cm. A line sign. This is normally present. A line sign. A coming from air. The air below pleural line. Air below pleural line reflect most of ultrasound back to the transducer. This itself reflector, meaning some ultrasound go back between pleura and transducer, generating artifact calling A line. A line, it's a horizontal line. A line, horizontal line, present below pleural line, result from air reflection of ultrasound wave. This is examples of A line sign. A line, dry lung, as in asthma or pneumothorax, we found the A line. Decay with depths obliterated by B line, as we talk later on. Air is not good transducer of sound wave. Air not good transducer of sound wave, so sound wave scatter at air pleural interface. Sound wave which produced from our probe scattered at air pleural interface, producing what's called A line. Air not good transducer, as we talked before, which reflect ultrasound. These examples of A line. This is A line, horizontal line present below pleural line, and this is bat sign. Bat sign. This is rib line with distal acoustic shadow. In between two rib there is white pleural line, which is present at white line 0.5 centimeter below pleural line. Absence of A lines implies replacement of air in the alveoli with substance that transmit sound wave, like blood in hemothorax, lung contusion, water as interstitial or alveolar edema, infection, pus as pneumonia, contusion, tumor. Any replacement of air in alveoli with substance of this material, making absence of A line as one of signs in pneumonia, which we target in this lecture. Lung sliding, another normal lung thoracic ultrasound sign. On inspiration, visceral pleura slides against motionless parietal pleura. On ultrasound, longitudinal scan, logical way to see this is dynamic. Every lung shows sliding unless pathology or not aerated. Now, lung sliding sign. Sliding of the visceral pleura as seen is echogenic line. This is under overlying parietal pleura. We see sliding of visceral pleura under. This is pleura which sliding. You see sliding of visceral pleura under parietal pleura. It's normal sign. Absence of lung sliding is significant and is diagnostic of many diseases. Now it's evident. Lung sliding, sliding of visceral pleura under parietal pleura. Normal seizure sign, another sign which normally present in lung ultrasound. Above pleural line there is motionless static structure chest wall. This is sign we diagnose it, but M mode, not P mode. M mode in ultrasound. This is C, which reflect structureless chest wall above pleural line, which is motionless and static. And in horizontal lines on M mode against time equal wave. Sand. What's mean by sand? Below pleural line, this is pleural line. Dynamic of lung sliding result in motion of visceral pleural line, which is reflected deep to it, giving granular pattern reflecting motions. Now, this is pleural line. This above pleural line, this below pleural line. Above pleural line, static, motionless structure chest wall like intercostal muscle, skin, subcutaneous tissue. Below pleural line, we found what is granular pattern. Resulted this granular pattern from lung sliding. Motion of visceral pleural line reflected deep to pleural line as granular pattern like sand. This is normal seizure sign. like sand on beach. Sand on beach. This is sea, and this sand on beach, so-called normal seashore sign. Absence of this sign is diagnostic of pneumothorax. This is again seashore sign normally. What's ultrasound finding in COVID-19? Ultrasound finding COVID-19. Anterior lung we found sliding sign, P-line pneumothorax, lung base effusion consolidation pulmonary edema, cardiac diagnosed pulmonary embolism. Important finding in corona chest ultrasound, absent sliding sign, P-line effusion consolidation. B-line, we talk about A-line, then we talk about B-line, vertical line in wheat lung. Sound wave trapped in fluid-filled lung, either alveoli or interstitial. Fluid-filled lung in alveoli, as in pneumonia, or in interstitial as interstitial syndrome. Trap sound wave and reverberate within this interface. Again, fluid-filled alveoli or interstitium will trap sound wave. This wave reverberate within this interface, result in B-line. Reverberation result multiple vertical bright white echoes extended to screen edge, called B-line. This is B-line have important features. Multiple B-lines. This is represent interlobular septum and appear small, well-defined. B-line. This is B-line. What's important feature of B-line? Three constant feature. All the name comet-tail. Always arise from pleural line, perpendicular to pleural line. This pleural line, this perpendicular white line called the B-line. Remember that A-line is horizontal. Again, it moves in concert with lung sliding. It's important sign, and is motionless low lung sliding, abolished. So we found B-line move with lung sliding. If lung sliding absent, it will be motionless. Four features of B-line always present. Long, vertical, not fade, continuous to depth of the image. Well-defined, laser array-like. Erasing A-lines, hyper-echogenic or wide. This is 7 features of the B-line. Waterfall sign, which found in pneumonia. Sound wave trapped in fluid-filled lung, as we talked before, result in this reverberation white B-line. Chest ultrasound in pneumonia, we found many signs. Tissue pattern hepatization sign, shred sign, air bronchogram, fluid bronchogram, dynamic air and fluid bronchogram, vascular bronchogram. This is what's called hepatization. Again, fluid-filled alveoli will change shape of lung in ultrasound as liver-like tissue, so-called hepatization signs or tissue-like signs. This is lung replacement of air in the alveoli with fluid or pus in pneumonia, give tissue-like sign, or hepatization liver-like tissue. It's liver, diaphragm, supradiaphragmatic basal lung consolidations. Echogenic consolidations with highly echogenic branching linear pattern. We found branching white linear pattern. This is called the air bronchogram. Again, air in ultrasound appear as white line. Air present in alveoli or bronchi with surrounding areas of fluid replacement or consolidation. This air appear as white line. It's called air bronchogram ultrasound sign. Air bronchogram. Branching echogenic linear pattern. This vary according to respiratory cycle, changing location, size, and shape. So change size and shape and the location of air bronchogram according to respiratory cycle or movement, inspiration and expirations. It's very important. Air bronchogram, it's not fixed in position, it is moving in screen. This is fluid bronchogram. Post-stenotic pneumonia, posterior intercostal show hypoechoic consolidated area that contains an echoic branching tabular structure. Now it is a hypoechoic, not echogenic like air bronchogram, so called fluid bronchogram. This is example lung consolidations, tissue-like sign, air bronchogram, and so on. This is another sign called vascular bronchogram. Branching vessels in consolidated lung is called vascular bronchogram. So we have three types of bronchogram: air bronchogram, fluid bronchogram, vascular bronchogram in cases of pneumonia, lung consolidations, right lower lobe pneumonia. This is examples of true case left basal pericardic pneumonia. We found hepatization or tissue-like consolidation, multiple movement of white lines. This is air bronchogram, moving according to respiratory cycle, multiple rockets or B lines. Multiple rockets or B line. We found vertical lines also present in this is multiple B line. This is another right lung pleural effusion with pneumonitis and consolidation, air bronchogram, septal thickening. Example: this is liver diaphragm effusion, septal thickening and consolidations, and we found air bronchogram. This is cases of right-sided pleural effusion with quad sign and consolidation. Thank you for listening.